Why is electric tooth
Over handheld?
Yeah.
I think because it has a timer. I think if you do a good job of doing the 2 minutes, for sure, I think
that's the main reason?
Yes, and also I think pressure. Some people brush so hard, so their gums are like receding because they think brushing harder is like brushing better.
Oops.
But it's not always. Also, people that put like this much toothpaste, they think it's a detergent.
How much toothpaste?
A pea size.
Hi guys, welcome back to another episode. I'm Sarah, one of your co-hosts.
I'm Adrian, I'm your other co-host, and today we have a really special guest. Do you want to introduce yourself?
Yeah, hi, I'm Joanne. So I'm actually a fourth year dental student at Rutgers. I got to meet Sarah through church, and I'm so excited to be here to share just like kind of, I guess, like the day in the life of a dental student, just who I am and just like my life.
Joanne lore episode.
I'm done.
Are you nervous?
A little bit. I'm excited.
It'll be fun.
Yes,
It'll be fun. So as Joanne said, we have a student dentist here who is almost done. And today's podcast will kind of just be getting to know more the day in the life of a dental student. She does a little social media on the side. But it'll be fun to get to know a little more about Joanne. And if you're a dentistry student or you're considering dental school, this might be the episode for you. I think it'd be interesting to start off with just like, what is a dentist? I think in our heads, it's just like the person you go to like get your teeth cleaned. But are there any like other, I don't know, roles that a dentist can fulfill for the general like public knowledge?
Yeah, so a dentist is like a healthcare professional. I mean, yeah, we do specialize in the mouth, but it's also like head and neck. So even in school, we do like during like oral surgery rotation, we do a lot of like oral examinations, like palpate and stuff. So we're kind of like diagnosing a head and neck area. But I think generally when you go to a general dentist, they are diagnosing things like in your teeth. And usually, like some dentists do the cleanings, but I would say mostly the dental hygienist would do the cleanings, and then the dentist comes in to do the exam. But every office runs a little bit differently.
Okay, I see.
In school, do you learn the dental hygienist roles?
Yeah, because we don't have a hygiene program, we actually do all the hygiene. Honestly, yeah, I think hygiene's really important, but at the same time, I'm like, I didn't sign up to go to school just to clean people's teeth. But it is like important, and I think there are programs that have both, so it's a nice collaboration.
Yeah.
Wait, how long is like a dental hygienist program?
I think it's like 2 years.
2 years, okay.
Or I'm not sure, but I think you can, it's quicker, yeah. But I think it's nice to have, yeah.
And you come out like, so as a dental hygienist, hygienist, you have to practice under a dentist,
yes.
I assume? Mm-hmm. Oh, so it's like the PAs almost of like a doctor.
Yeah. And then dental assistants, depending on the state, you can get trained on the job, or you do like a dental assistant training thing.
I see.
Because some states don't let you take like radiographs, like x-rays. But some places, like some states are like, if you get trained on the job, you can. So, different regulations.
The more you know.
My mom always, whenever I get x-rays, they have the like, thing on you, and then she's like, make sure you like push it up so your throat and your glands are covered so you don't get x-rayed. So me underneath the like blanket, I'm just like pushing up the blanket as much as I can, and people are probably like, what the heck is she doing? Because they'll like take it off and I'm just like scrunched up. No,
but there are patients that are super scared about that. They're like, like
the x-ray stuff?
Yeah, so they're like, I don't want to take x-rays. And you kind of have to make that decision, do you want to treat this patient? Because if you don't have x-rays and something does happen, you're like liable. So it's like a gamble.
That is so interesting.
And you need to do x-rays once a year at least?
Well, okay, some places do every 6 months. I think it's kind of needed as you go. I think every year is better because I don't want to like overexpose people. But if you need to like see an area, I think you should take a photo. But if it's not necessary, I wouldn't. Yeah.
What are the dangers of x-rays?
I guess like radiation, but at the same time, it's so little. Like we use our phones every day.
Yeah, people sleep on their phones.
Yeah. So we tell them like, you're literally exposing yourself. So this one little picture is not gonna make or break your life.
Oh, that's so interesting.
Yeah.
Are there any like dental clinic red flags? So I don't bring that up because like for PT, sometimes you can like do one PT and then a bunch of like PT like techs who aren't like trained to be a PT yet, but they like show you your exercises and whatnot. I don't know if there's like one dentist and just like a bunch of like dental. Is that a thing?
There's this thing on TikTok right now. It's like veneer techs. So people are like, shaving people's teeth down. Yeah, and also like it wasn't Invisalign, but you know that company that did like the aligners. They're kind of like bankrupt right now and like getting a lot of like lawsuits because like it wasn't dentists that were like diagnosing them. Yeah. I forgot what it was called, but
wait, that's crazy. Oh, that's so scary.
How did they know that they needed to have certain certifications to do that, or
I think technically
did they really just not know?
I'm not sure because I think they just market it as like, aligning your teeth and making them straighter. So people are like, oh, it's so much cheaper, it's so much quicker, you just do it at home. But then I think down the line people realize like it did mess up with their teeth. So
that's pretty bad.
Yeah.
That's so sus. Oh my god. All right. Okay. A lot of dentist facts. Let's start from the beginning. Like, how did you get into dental school? I always ask this because are you like into teeth? Because I'm into the human body. I don't know if you're into the teeth like
That's
that.
crazy.
So honestly, like I didn't start off just like liking teeth. It was more like my parents immigrated here, so I always wanted to be in the healthcare world because I would go to their appointments and they don't speak English. I was kind of like their translator. I was like, oh, there's such a big disconnect of like healthcare professionals and like even like nurses like treating people that don't speak English well.
Right.
So I was like, oh, I want to do something. And also like because we're Asian, you know, doctor is like all we knew, right? So I was like, okay, I'm gonna be a doctor. And then I went to college and then I joined pre-dental society because my roommate was like, oh, let's go.
What did you join college as?
Just like pre-med or pre-health. But I was open to like exploring different like majors and stuff too because I didn't want to be just tied down because I didn't know like all these different majors and I honestly took so many different classes like dance classes, calligraphy. Like I took so many just to like air it out and try things out.
Yeah.
But then once I shadowed a dentist, I was like, oh wait, I can see myself doing this because I've also loved doing like arts and crafts, like baking and stuff.
Like
so I was like,
hands-on.
Hands-on, like and how I could serve people with my hands because I think medicine, I think you still serve, but it's more like I think for me at least it felt like you're just kind of treating the symptom, but then I felt like for dental like we can kind of get people out of pain right away. And I went on like a medical mission. I was like, oh, this is cool and I feel like I can utilize like my career to serve others. Yeah, so I was like, oh, art and science together.
Whoa.
Yeah.
That's so true. When you say you can help people get out of pain right away, how does that look like in dentistry?
So they come in as emergency. It's not like the ER where people are like actually like you see them like immediately, but a lot of people come in like holding their cheek or something, or they're like swollen because they have an infection. So if you like extract it for them, like I feel like they're immediately out of pain. I mean, they're still like lingering pain, but it's more like the site of the infection is like gone. So now they don't feel that like throbbingness as much. It's more just like the dull aching pain from the extraction.
Oh, and then which will like heal.
So I went on a mission trip where we did so many extractions, and like people are so thankful that you just took their tooth out. You know.
Was this through school or like?
No,
church?
it was through like a Boston organization.
Oh, interesting.
Yeah.
Wow.
So that's something I want to also do in the future and give back, because I feel like it could be very useful. And like,
I see.
Yeah.
Wait, that's crazy. Do you know MedLife?
I think
Have you heard of MedLife?
It's one of those like service foundations, right?
Yeah,
is it kind of like Doctors Without Borders?
Maybe, yeah. It's like you go to like
different countries.
Underserved places. So like my trip was to Peru, so we'd go like in the mountains and stuff and hit like underserved.
Okay.
Yeah, with Jenny.
Now.
What'd you do there?
So I think we had different rotations. They had like a dentistry booth. They had like normal triage. They had a gyno. They had the vitals and stuff like that. And one of them was that I was doing was like pricking people's fingers to get their glucose stuff, but I accidentally pricked too hard for one of the women. Anyways, I didn't go deep enough, and then I tried again.
HbA1c test?
I think it was just like a glucose, like a current glucose reading, yeah. But for the dentistry, I did shadow that one time. They were like, "Oh, do you want to like watch an extraction?" I'm like, "No, thanks. I don't think I could do that."
Oh, you're not gonna with like blood.
I was shocked that they were just doing extractions there, but they
and
did
like
a
standing
lot.
up.
Yeah.
And just pulling them out.
Yeah.
Like candy.
Mine.
Did teeth ever gross you out? Like, did you have to get over that or never bothered you?
I don't think it really bothered me, and like blood
Okay.
didn't
And
really
blood,
yeah,
yeah.
it didn't bother me, but at the same time, like some people come in with really gross like teeth. I'm like, oh, how do you live like that?
Oh.
But I mean, we're wearing a mask, thankfully,
Right,
but you
right,
could
right.
smell sometimes.
Ooh. Wait, did you have cadaver lab?
Yeah. Oh my gosh.
Wait, what's your opinion on cadaver lab for dental
Wait,
school?
I feel like you
Because-
kind of like it.
No, hold on. No,
You're
no,
like
it was,
smirk right
it was
now.
funny because like at Columbia when we did the cadaver lab, the PT students had their own cadavers, but the med students had to share theirs with a dental student.
Oh.
But they had way more bodies. They had like maybe 4 students to 1 cadaver. Ours is like 6 to 1 cadaver, which is bad for us, but. I could hear like the dental students like grumbling the whole time. They're like, "Why do we have to dissect
I
this leg and
know,
arm?"
yeah.
Wait.
No, so yeah, we
We
have
did the
to.
whole cadaver.
Why?
I don't know, but like, I guess it's
Remains
like
a
the
mystery.
whole like body.
Yeah.
Yeah. But at the same time, for us, like they did a lot more like testing on like the nerves.
Right,
and the neck
right,
and
right,
the
right.
head.
Oh, I see.
Yeah, but oh my god, the smell.
It was-
So people will put like the tiger balm here, or like
Really?
because then you don't smell the
Did your professors try to like? So my professors would always say like, "Oh, just imagine you're like smelling pizza and it all goes away."
What?
And then it
Did it
ruined.
work?
No, it ruined pizza for everyone the rest of the semester.
Why would they say
We would be
that?
eating like Domino's and like
Oh,
smells
no.
like smells like cadaver.
And then for us, like anatomy lab was either right after lunch or right before
Oh
lunch.
my
I'm like,
gosh.
oh no.
Wait,
Jeez.
or did they say to pretend like you're smelling pizza because it somewhat resembles pizza? Or like, why did they say that?
I think like it depends on the cadaver that you're working with too. Like I think if it has like higher fat content, you can really smell like the fat.
Oh yeah, and like
Yeah.
especially in the intestine.
Yeah. Especially like in
Yeah.
the abdominal area, because like once you open that, it's just like.
Ooh.
And then like once you like finish the cadaver, you don't like put the skin back on. It's just like laying there. Like you put a cloth over it with like the chemicals and whatnot. But like whenever you uncover it, it's just there.
Oh, nice.
So
That's really nice.
interesting. I was just curious about that.
Yeah, but we did share it with like the
Yeah.
medical student.
My friend was a roommate with a dental student, and we're just like studying the same thing. He's just like mad the whole time. He's looking at the foot. He's like, "Why is this relevant?"
Yeah.
Oh, interesting.
Did you also have that thing where like they used to like put a string on each like let's say a nerve or like an
Yeah.
arm, and then
Mhm.
you have like 10 seconds. You have to write on a clipboard. Next, so we would rotate, and that was our exam.
My
you get like 10 seconds.
my professor
gosh.
1 year, like one day was our unit was like the neck area basically, and she's like, some of your bodies are poorly like dissected. So her and her assistant basically went in and made their own dissections and would pin the nerve through like a hole of a muscle, and we'd have to like bend down, look at it.
Oh
We're
my
like, what the
gosh.
heck is that?
Because you can't touch it, right? You
Yeah,
have to-
exactly.
yeah.
I'm like,
And
And
that's-
you have to say like right side, left side.
no, literally.
Yeah.
I'm just like, I don't know what I'm looking at. It's like they're like I don't know.
And they all look different.
They all look different.
Yeah.
Oh my
but
god.
that was hard. That was so hard.
You had to identify nerves?
Yeah.
That's
Yeah,
insane.
Like it's like skinny.
yeah.
Yeah.
But there
Like
aren't there
valves.
so many nerves? How do you know which one is which?
Well, it's like based on like location and like what.
You use like other muscles to kind of like guess what it is.
Oh yeah, muscles.
Oh my god.
Different like bones.
That's insane.
Yeah, that was stressful. I do not think fondly of those days.
Throwback, right?
They're so throwback. All right. So you're in dental school. It's 4 years, right? Is residency required or?
So depending on the state, so like New York, because I want to possibly come back, I'm doing the 1 year. So New York requires 1 year, whereas like New Jersey, you can work right away.
Really?
Yeah. So I'm doing the 1 year. I think it'll be really good mentorship and also another year of learning. While you get a little bit of pay, so that would be nice. And then, even though I went to school, I don't feel like super ready to work. And
I was just gonna ask you that.
Yeah.
Like, do you
How did
feel?
you feel?
Well, I'm not doing like surgery almost. But fourth year, I felt okay. I did feel like definitely right now as I'm practicing, it's a lot of learning on the job.
Yeah.
Not that I can't treat you safely, but it's just like it's the small things, right?
Yeah.
So I do feel like I kind of wish I did residency, and I am thinking about going back at some point.
Yeah, it's never too late.
But yeah, I do see the value. I think the biggest difference between physical therapy and dentistry is I do feel like there is a level of maybe how do I say this? I think what you guys deal with in terms of like procedures is a little more complicated than PT. So from that aspect, I can appreciate how residency is very important for dentistry. But like an ongoing discussion in the PT community is that they feel like it's not worth, especially the money and the time. Like you can just learn on the job.
Yeah.
But I do understand where like there are a lot more like niches that
also like more, I guess more invasive.
Exactly. That's the whole point.
Like maybe not as reversible.
Yeah, for sure.
Yeah. How about you when you started working with people?
Oh gosh. Well, I think when I was in my rotations, I was like, I think that's what kind of deterred me from practicing after graduating, because I was like, I don't feel confident in my knowledge to like make the best decision. Yeah, so it's tough.
Yeah.
But I feel like now being out and like seeing my friends that are in residencies and stuff, and like people also starting jobs, especially in healthcare, I'm like, yeah, all of it is just you learn on the job. Like you have the foundation from school, but like the treatment guidelines and stuff are always changing too.
Yeah.
So you always have to be on top of that. And it is like you just learn on the job, because like you learn from other practitioners that have their experience, and every single practitioner has different opinions and advice on their best treatment methods. So like you kind of just collect those over time.
Right. I feel like my professors would always say like the exam's job isn't a test how good of a PT or a healthcare provider you are, is to make sure you can't kill a patient.
Yeah.
And I think that's literally the entry for like entering
like
the
minimal
field.
competency exams.
Would you say dental school is very hard? Like the hardest thing you've ever done?
I would say it is one of the hardest things for me. I think so. I went straight into dental school from undergrad, and I think undergrad, not that it was like easier, but because like you kind of have like flexibility with your schedule, you can kind of like take different classes and you have some free time. Whereas like dental school, we were all taking the same exact classes together, like from like 8 to like 5, right?
Oh my gosh.
And I think also just for dental school, we take a lot of didactic, but also like lab. So, but it's crazy because at least our school, the lab classes were worth a lot, but the didactic was worth a lot more. So, but then it was counterintuitive because we're all like, wait, but we're going to be drilling people's teeth more than like.
Oh.
But then I think I realized like how important like medical history of patients is too, because depending on that might change your treatment plan. So they focused a lot on like the medical aspect as well. And then I think some dental schools take med courses with the med students at Columbia. So it really depends on like the curriculum too.
Do you have a favorite class and why, and then a class you absolutely hated and why?
I really enjoyed the lab classes, I think, because it was more hands-on. So fixed pros is like doing crowns, bridges. It's like drilling the teeth. I feel like it was kind of like soothing. You can turn on music. And and you can go in your free time. You have like this mannequin head, became your friend for 2 years.
Oh my gosh.
Because the first 2 years you're taking classes and working in the, like a simulation lab, or pre-clinic they call it. And then third, fourth year we're in clinic seeing actual patients. So I think just bonding with like people that were sitting next to you in lab and just drilling teeth.
The mannequin head.
Your bestie.
Wait, is it like literally like a mannequin head from like one of the models out there?
Wait,
does
it's
it look
like
the
it's
same?
metal.
It's the head's metal.
Oh my gosh.
And then you put like the typodont, which is the teeth, into it, and it's like a rod. But our school's a little older, so you have to like crank in the rod.
Oh my god.
Wait, what's
and
the rod for?
It like holds the head. Like pretend this is the head.
Oh,
There's a rod.
so it's like there for you to
and
work
then
on.
and you put it in and you crank it, and you can change it up and down.
Does it have like eyes?
It has like, I think it's just like clothes, but some people put like lashes on it, or googly eyes.
Wait,
Yeah,
I like
name their mannequins.
Did you do that for yours?
I think I put lashes on and just ripped that off.
I like the
She
lashes.
also shared it with like the second year or the first year.
Oh, I see. That's so interesting.
Yeah,
Dang.
but I think that was fun. And I guess hardest classes. Honestly, I think science is a little bit harder for me. So I think like oral bio or like biochem. Like we had to take
You
a
had
lot
to
of
take biochem
We
in
had to take a
dental
lot
school?
of like those foundational classes our first year.
What the
But then
heck?
also I think oral pathology was one of the hardest too, because it's like looking at a picture and you have to like what the differential diagnoses are, and it can be so many different things. So you're like, yeah.
That's crazy.
And everything looks the same.
Yeah.
Did you pull out all-nighters in college?
I did. But,
Oh, no.
Yeah, but honestly, I don't think it's the best move. I don't think I function that well when I do pull all-nighters, but I do procrastinate a lot.
Yeah.
Do you drink
Yeah.
caffeine at all?
Yeah, I think I drink a lot of coffee
A lot of
to
coffee.
keep me up, or energy drinks, but it was not a healthy lifestyle.
I always tell my friends that this caffeine like spike was only grad school, and when I graduate, I'm gonna like wean myself off, and I have not done that yet.
Not yet?
I'm still drinking so much caffeine. It's so bad.
Oh, wow.
Yeah, you had a peak, but then you like kind of stopped, right?
No, it's back. I'm back to drinking a lot of caffeine.
What do you drink?
So I'll drink coffee when I get to work, and then I'll like drink more coffee, and then I'll drink a Celsius during lunch, and then I go to the gym like almost most of the days of the week. I'll drink a pre-workout before that.
Gosh. And then, do you have a hard time falling asleep?
No,
Oh.
I go straight to bed. I check my Apple Watch. It's like my heart rate doesn't really change.
Dang.
It's just straight like. But then if I don't drink it, I get headaches. I literally can't talk to my patient. One day I showed up late to work, no coffee. I was like stuttering every other word.
You're a zombie?
No, I was like, I'm so sorry, I can't function right now. I was like, just do this. And then I went to go get a cup of coffee.
Oh my gosh.
No, it's bad.
How about you?
Dang. Coffee. I think lately when I don't drink coffee, I do feel like extra tired. And then, well, I've been doing matcha.
Yeah.
And then like randomly some days I'll have coffee and I'm so buzzed, I'm so productive, and I'm like, whoa, I should do this more often.
Yeah, I've been changing to matcha. I think it's like a more steady. Because now that I see patients, when I drink coffee, I get a little bit more jittery.
Oh,
so I feel like
really?
I kind of feel
Oh, your
shaky when I'm
hand.
holding
Oh,
the.
I see.
Oh, that'd be
piece.
so bad.
Yeah, so I think matcha is more steady for me.
Yeah.
So it's not as like a big spike.
I see.
Wait, question. Does your role do the anesthesia? For,
Yeah,
like,
so
extra-
we usually always inject unless they had a root canal because
Oh.
then the tooth isn't vital.
Oh, if you do then there's no nerves.
Nerve. And you would
Okay.
just like anesthetize like the gum, but
Oh, I
sometimes
see.
you might not even need to.
Oh wow.
Yeah.
Jeez.
I was always scared of the anesthesia
Okay.
shot. Yeah.
We put the numbing jelly, and if you feel like it doesn't even work sometimes.
I never got numbing gel before. I
So
had a
it's
lot
like
of
we
cheap
usually give
things
a
as
little bit
kid.
of benzocaine, the end of like a Q-tip. Oh my gosh!
Oh.
And then you just leave it there for like a minute,
Yeah.
and then you get the syringe ready for the
Oh.
lidocaine and just inject. We do a lot of IEN, so like for the mandible.
So when you graduate, like all these procedures that you do, are you supposed to be like a master of all of them, or is that kind of what like residency is for?
Good question, because like I think as a general dentist, you could do whatever you want,
Right.
Because you technically learned it all in school. But like endo, let's say root canal, they specialize in that. If you feel like this root canal would be too hard for you, you should refer out. Because if you don't, then like if
That's
something goes
bad,
wrong,
yeah.
it's kind of up to you. So I think just knowing like what you can handle and what you can't.
Mhm.
And I think we also have to do a lot of like continuing education courses.
Right,
So people
right.
do a lot of different specialties.
Mhm.
Yeah, and then they call themselves like a super general dentist because they could do so many things. But some people also like focus on like one niche thing.
So like what is considered, okay, this is like a dumb question. What is considered like a hard procedure and an easy procedure? Because like for example, I got veneers done a year ago because my teeth were messed up, and then they're like, we'll do veneers for you.
You have
I-
veneers?
Yeah,
I
I
didn't know
bought
that.
them too.
Oh, I didn't know that.
Yeah, it turned out really great, but the process took so long, and I was watching him do it, and I was like scared for my. I wasn't scared because like
Did
I
they
just had
look like
never
this?
done veneers. Because you know what they do?
They shave it.
I've heard that, but I
They
don't know what
shave
that
your tooth down till it's like that big, and then he like brought the mirror over, and I saw my teeth. They're like tiny nubs. I'm like, what is going on?
Oh my god.
And then you have to like literally craft it, right? Like craft a tooth, and
Yeah.
he like adjusts it, and then like
Wow.
And
does
then
all
they
that.
send it to the lab.
Yeah.
So you have temporaries. So I think hard and easy. I think it really depends on the person. For
Okay.
me, I think like, yeah, root canals is really hard to see. It's like in. So a lot of people wear microscope. They have a microscope. Yeah, but I think easy. I'm still like trying to figure that out. Like I don't know. It's
Like,
easy.
can a doctor mess up braces? Not sorry, a
I
dentist.
guess feel like it could be reversible.
Okay, that's
Whereas
fair.
like yeah, Invisalign, because you scan it. I think that's what's nice about Invisalign. You scan the teeth with the iTero, and then you send it to the Invisalign company, and then a lot of the orthodontists they like tweak it. So I'm actually getting Invisalign at school right now.
Oh.
So I'm working with the ortho resident, and she works with like the ortho attending. And even though the Invisalign file comes back to them, I think some general dentists like change a little bit here and there, but because they're so specialized, they're tweaking like every little tooth, and like I've had different attachments here and there to like
Whoa.
grab onto the areas to shift it better.
Oh.
Yeah.
Is Invisalign stuff something that you can do, or is that for orthodontics?
So general dentists could do it if the case is not as complex.
Oh.
Yeah.
Wait, what's
Yeah.
the pathway to become an orthodontist? orthodontist?
So same thing with us, like 4 years of college, then 4 years of dental school, and then 3 years of residency. I think there are programs that are 2 years, but the crazy thing is you have to pay. Except certain ortho
for residency?
Yeah.
What?
Dental residencies, unlike medical, you have to pay. Except like general practice residency and like certain ones, or if the school has like a union and all the residents get paid the same. Yeah.
Wait, sorry, you said dental residencies you have to pay?
You have to pay.
The one you're doing, you're getting paid.
I'm getting paid.
Okay.
Because like if you have on call, you should get paid. So a lot of GPRs, they call it. I'm doing an AEGD, which is like Advanced Education General Dentistry. It's more private practice oriented, whereas GPR is more hospital oriented. But yeah, a lot of like specialties like perio, endo.
Oh, that's so
like,
interesting.
You have to pay, which is crazy
What?
because we come out with a lot of debt.
Wait, is that normal for other residencies?
PT residency, you have to pay for the program, but you do get paid because you're also working in clinic, and a lot of PT residencies, you teach a staff at your affiliated hospital or school.
Oh.
So
So it evens out? Kinda?
the pay isn't to the point where it evens out, but it helps a little bit, I guess.
Yeah.
Yeah. But that's so weird.
That's why some residents that
Yeah.
specialize, it's called moonlighting. On the weekends, they'll work at an office.
Oh, I see.
But yeah, it's crazy.
Oh my gosh. Remember you said you wanted to end up in like aesthetic? I don't know if
Yeah.
that's the right terminology.
Like cosmetic dentistry?
Cosmetic,
Yeah,
yeah.
I do. So that's not like a specialty. People just call them a cosmetic dentist. You do a lot of like continuing education courses, and it's kind of like you brand yourself as that, but it's still under the umbrella of general dentist.
Oh,
but
okay.
a lot of prosthodontists, so that specialty, prosthodontics, like specializes in like full mouth, like rehab and like just a lot of like teeth movement. So I think they would be really, it's like a 3-year program, so they're really good at like aesthetics and
I see.
just like big cases.
Dang.
Yeah.
Wow.
All right, we kind of need to move away from the dentist stuff for a little bit. So I do want to talk about social media a little bit because you do post on social media. I looked through a bunch of your videos actually. They're fun. They're really cute. Like it gives.
Thanks.
Wait, the one where you're dancing with your mom.
Oh my god.
That was so cute. I don't know. Do you consider yourself micro influencer or just you like doing content? Like if you had to put a label on it, where would you put yourself on that?
I would say I wouldn't even call myself a micro influencer. I would just say I just like enjoy making content. I do a lot of like filming, but I think for me editing is so much of a
Really?
battle. Yeah, because like rewatching and like changing it.
Right.
I'm a little bit of a perfectionist, so I think it kind of gets to me. But I think like the small videos like with my mom and brother or like with friends, those are really fun. But when it's like just focused on me, I get a little bit self-conscious.
So you never do like a vlog or anything?
Like I film them and then I'm like, oh wait, it's kind of cringy. But then I heard that like it's supposed to be like that and
Yeah.
people will like me for me.
Yeah.
But I don't know, I have to get over that fear.
Yeah.
What do you?
oh.
Go ahead.
What's your balance between like dentistry content versus like just lifestyle, personal content?
I think I'm still figuring that out, like, because I think there's a lot of dental students that do just like dental focus, but there are people that kind of incorporate their lifestyle. So I just kind of like film what I enjoy and put it up there. But I don't know. I'm still trying to figure like where I want to take this. Yeah.
Do you ever see like other, I guess, dentistry content on TikTok, or you're like, or whatever platforms you use, and you're like, that's not true, or like, maybe not deliberate like misinformation, but just kind of like, I don't know, like sometimes I'll see some PT content, and I'm like, you're definitely like just glorifying.
Oh, shoot. Or like there's like whitening hacks or like,
Yeah, like
those
this-
kinds of things. Yeah.
Yeah.
Yeah, like oil pulling or like the
Oh.
veneer techs or like people were saying like, oh, this is like the like baking soda or something will whiten your teeth faster. So I guess when I see that, I'm like, not really. But it's like, what could I do? I'm
Right,
just like,
right,
I
right.
hope people are not.
There's
doing
like
this.
pages where that profession, whatever, is like Blink reacts to
Oh yeah.
whatever. Yeah. Like I
There's
know
a
some
lot of-
pharmacists do that.
Do you think, I'm just curious from your like perspective, because you do a little bit of social media and you're a dentist, like, do you think social media benefits healthcare for the most part, or do you feel like that should be like separate? Just because I've seen arguments for both, and I just think like our generation is like the forefront of pushing that, right?
I think yes and no. For like if you own a practice, I think it's very beneficial because it's like a free way of marketing yourself. But I think it's also like as a patient, like just seeing that, you might not know like it might be a great picture of a case. But I think going to the office and getting more information. But I think social media does help like more information to be out there. But I think there can be a little bit more misconceptions sometimes because there's so much information on social media. So I think just kind of knowing like what's right or wrong. I think it's a little hard for people to tell. Yeah.
Do you feel like the general public is under-informed, just about right, or over-informed in terms of like dentistry stuff?
I think under-informed, at least like the patients I see at school. But at the same time, there are people that come in with so much research because they're like very scared or like they want to know everything. So
I always get like the Reddit warriors.
Yeah. And then they're like, oh, I heard this from this person. So I think catering your treatment towards like their personality and how they take it.
Interesting. Oh, poor Doge. Would you ever, so let's say one day your social media goes crazy, would you ever quit dentistry to do social media?
Oof.
Like, how much do you love creating content, like all that stuff?
Ooh, I think it would be cool. I maybe like work a couple days a week as like a dentist. I want to continue that so I don't like lose my skill. But at the same time, I think it'd be cool to do content too. I actually follow a lot of like healthcare professionals that kind of do both. A lot of dentists actually, and some people kind of like go the content way, and some people just stick to fully dental related content. So I guess I'll see like where it takes me. Yeah, I don't know, because at this moment, because I don't feel super confident like from just graduating to work on people's teeth.
Right.
I think content seems more safe and like harmless. But because a lot of dentists say it takes at least 5-10 years to be comfortable.
Oh my God.
And I'm like,
Really?
I want to do it now. Like I want to get there now.
Yeah.
Oh my God.
Yeah.
Wow.
So like a lot, and also I think about a lot of cases that I feel like I wasn't, like it felt to me it wasn't the best. But
Yeah.
like I'm reminded that I did the best of what I could do at that moment. But you just can't help but think like, oh, I could have done a little better. Yeah.
Oh, that's actually really nice. I feel
Yeah.
like over marketing is definitely like really common in the social media world.
Dang. I feel like it's so hard as a practitioner because I think that's also why I was scared to practice because I'm
yeah.
like perfectionist. I want to
Yeah.
be the best pharmacist for them, and like if I don't feel like I know everything, then like how can I practice at my best?
No,
but
totally.
I totally get like people have to start somewhere. Like even the best practitioners need to
Yeah.
just have time and practice in that area. So it's just like the way that it is
No, for
in
real.
healthcare.
That's why I get also like nervous to post dental content because like dentists will see it and be like, oh, it's not that good, you know? Like it's just like perception.
Yeah,
Yeah.
definitely. I did a PT episode with some of my boys like a couple months back, and in hindsight, it was like kind of like what were we doing? But also, I do know like some people who watched it and like benefited from
Yeah.
it. So it's just like it's like you said, it's like perspective, right? Like I'm sure there's some undergrad dental student like looking at you, and it's also like, I want to be where she is one day.
Yeah.
You
Yeah,
know?
so I think that's what's been really fulfilling. Like I'll
Right.
get like messages from potential like
Aw.
future students
Wow.
or like interviewing or like looking into becoming a dental
Yeah.
student. So I think just having that good community and just sharing information and resources while you can. Like there are also like international students that join our class at the end of our second year. So some international students like message me through Instagram or TikTok, and I'll like connect them to like someone. They're like, let's say they're from like Peru, like one of my Peruvian friends.
that's so cool.
So that they like, it's like an easier transition for them.
Yeah.
You know?
Oh,
So-
that's
You do
really
what
nice.
you can. You like give back. Yeah.
Yeah.
Jeez.
If you have a larger following, or like even the following that you have now, like on social media, and you're practicing, do you ever feel weird about like, what if my patients can look me up, or like, what if my patients find my page?
No, I totally feel that, and I think it's because our generation, like social media is more like
Yeah,
popping.
you just, like, look
so
them up.
people will just like look people up.
Wait, there's this dentist that I see. She like practices in New Jersey, and then she has some like she does like a day in the life, but literally it's like in the day she's like wearing her scrubs and stuff, and then at night she's like in her like going outfit like at a rave or something, and I'm like, girl, her entire account's like that.
I know, that's why I'm like, oh, like sharing too much. Like,
Yeah,
where's the line?
exactly. Even like doing this podcast. So the coworkers I have now are the ones I did my clinical rotation with, so we're pretty close. But like 2 months in, I get a text, I found your podcast. And I'm like, oh. Even like we get dinner sometimes, he's like, oh, how's your podcast doing? And I'm just like, I don't know why. I'm not like the most comfortable talking about it.
Yeah, especially at like work.
Bring it into work.
Yeah.
I don't know. That's something I'm still working around, but
Yeah. You have like two identities. It's like
or
your work
like,
personality.
What's her face? Mickey Rye, the nurse.
Oh yeah.
Like she's so big right
She's
now.
so
but
big,
she's still
yeah.
practiced as a nurse. I'm like, that has to be so.
Do you feel seen, perceived?
Yeah.
Interesting. Well, hopefully you continue that when you go to residency.
Yeah. I think it'd be fun to just meet other dental students on the West Coast.
Yeah.
And also like residency.
Yeah.
I'm hoping there will be a little bit more pockets of free time to film, and maybe I can just do like throwbacks to like when I was in dental school, because I have all this footage on my phone.
Oh. Yeah,
but
that's
now
the
I'm
trap.
like, yeah, because there's so many requirements to fulfill. But now I finally feel like I have a little bit more time.
You're
Do you
almost
feel
there.
like residency will be more free time, or like?
Yes and no. So I picked a program where I really like the program director because he like studied in Korea and like he was a specialist. He was a prosthodontist, and I think when I was talking to the residents that are there right now, it's kind of what you make of it. So if you want to do a lot, you could. If you don't, like it's really how you cater.
Cool.
Yeah.
So we're gonna do some like rapid fire dentistry questions. So kind of like this is space for whatever Sarah and I want to ask you, but it'll be like very, very like easy questions, you know. So I guess the first one is between electric toothbrush, a handheld toothbrush, and a water pick. Which one's the best?
Electric toothbrush.
Why?
Really?
Yeah.
I heard so many good things about water picks.
Wait, isn't water pick for
is
flossing?
For flossing.
Oh, true.
But move on to the next question. Wait, but why is electric tooth?
Over handheld?
Yeah.
I think because it has a timer. I think if you do a good job of doing the 2 minutes, for sure, I think
That's the main reason?
Yes, and also I think pressure. Some people brush so hard, so their gums are like receding because they think brushing harder is like brushing better.
Oops.
But it's not always. Also, people that put like this much toothpaste, they think it's a detergent.
How much toothpaste?
A pea size.
Like you don't need that much.
No,
I
you
literally
literally, like,
glaze
this
my
much.
toothbrush. And
Oh my gosh. Yeah, like the whole
I think
log.
people think it's soap, but it's actually the motion of brushing that's doing the job. Like it's like if you had a toothbrush
the
versus
motion
toothpaste,
of the ocean. Sorry.
might have to cut that one out.
we keep it in there. Yeah. So the like the if I had a toothpaste or a toothbrush, I think brushing with a toothbrush just without toothpaste is actually better.
Wow. Interesting. Okay, so
Myth debunked.
you know, like Oral B versus
Oh, yeah.
Sonicare?
yeah,
Yeah.
I know they have different
Get all your
styles.
brand questions asked right now.
So I've used both.
Yeah.
And I actually, as periodontists, they specialize in gums. They think Philips Sonicare is better because the head is longer. So it's like more surface area. But then some dentists say Oral B because it oscillates and rotates. So it like vibrates and turns. So I've tried both. I don't know which one I like more.
Yeah.
But I used my Philips and then I gave it to Matt. And then with a different head, of course. And then because we got a new one through school, Oral B, so I was trying that out. And like you can connect it to your phone to like track. Yeah.
Oh, what the
It's
heck?
nice because every 30 seconds it'll beep, so then you know to move to the next quadrant.
So I've tried both too, and my orthodontist gave me the Oral B one, and so I've had that for like years.
Yeah.
And I mean, I liked it, but I feel like you can just get a different head, like a longer head. But now I have the Philips, and it's like quieter. But my thing with the 30-second buzzes is that somehow, so I start in my lower right and I go to my lower left, which I feel like the instructions say it shouldn't be 4 quadrants. It should be like the bottom outside, the bottom inside, top outside, top inside, instead of quadrants. Like when I read the manual, that's what it said. But I'm like, no, I do quadrants. But I'll get from like lower right to lower left, and then I go upper left, and then it stops because I think I just spend too much time in one of them that I don't notice the buzz.
The buzz.
I then have to restart it to get my last side.
I guess you're doing more than 2 minutes. Better than
Is there such thing as overbrushing your teeth? I know you mentioned the gums thing, but
Yeah. No, I don't think so, unless you're doing like longer than like 5 minutes.
1 hour.
Oh my gosh.
But
Okay.
well, you go.
Well, one of my friends, her dentist told her that she was brushing her teeth too much
Oh,
because her like gums were receding or something.
maybe she's brushing really hard.
Oh,
Oh,
maybe.
also the bristles, like soft bristles are really
Oh.
good. I think people think harder is better.
Like
but
it gets
dang.
more off.
Yeah.
Oh, okay. Another thing is that someone said that it's not the teeth that are staining, it's the plaque on the teeth that stain. Is that true?
Yeah, it could be the plaque because it'll build up. But I think the teeth could also like when we do people's cleanings, like you can use the Cavitron, like the little sonic scaler, to take off like the staining of the like coffee or like tea. So I guess it's like both.
Is that something that you get at a normal cleaning, or do you have to ask for that?
No, you probably get it done at a normal.
Oh,
If your
okay.
teeth are clean, you probably won't notice a big change. But I have patients where there's so much like plaque and calculus,
Yeah.
it like flicks off. It's kind of
Whoa.
satisfying.
Whoa.
It's been like it's a little gross because it's like it's been hard in there
Yeah.
for like a long time, and it like bleeds. But
Wait, what device is this that gets?
The Cavitron, it's the one they use. Like it has like a little.
Oh,
thing.
wait, is that where they? That's not the polish.
No, not the
Wait.
one that spins. It's like it makes like a sound like zzz, and it shoots water.
Oh,
And it
Are
goes
you talking
around.
about the drill?
The Cavitron. It's like water and just like
I see what
ultrasonic
you-
vibration.
Oh, I see. That's
Oh,
what
I
they.
see, I see,
Okay,
I
so
see.
instead of manually,
Yeah,
like
you can
doing
do
it-
both.
Yeah. Okay. I've noticed over the years that my dentists have shifted into that, and then they'll always ask like, "Do you want?" Because it's kind of intense sometimes. So I always ask like if you want numbing gel.
Oh
and
yeah,
stuff. Yeah.
Because people bleed a lot.
I'll
Okay,
come back.
floss, water pick, or the type of floss where it has like a handle.
Oh yeah, string floss all the way.
String floss all the
but
way.
I think people don't like it because it's more like work.
Labor intensive.
I've been using. My sister put me on bamboo floss, like the black, and
Oh.
it's thicker, so it gets rougher. Because I don't like the floss that's like flat. Because
'Cause
I'm
it-
like, how does
yeah.
that get anything? It just goes in and goes out. Like it doesn't
The
catch
glide
anything.
one.
Yeah.
Apparently, I heard some of them had like Teflon in it or something.
Oh.
Yeah, but I use cocoa floss. I like that
Oh, I
brand
heard-
a lot.
yeah.
'Cause I think it's probably thicker like the bamboo
Little,
floss.
yeah.
What's
so
cocoa floss?
It's a brand.
It's
It's a little
expensive.
bit more like waxed.
Yeah.
Yeah. It's a little
Oh.
thicker. So like when you floss, you're supposed to like go in and then hug the tooth and out. So like you have to do both like distal and mesial, so left and right of the tooth. You hug it. Whereas like the handheld one, because it's straight, it only goes up and down. Yeah.
Interesting.
But water picks are great, but we wouldn't say it's like a substitute. Like it would be like a great addition. But I would rather you use a water pick than not floss at all.
I see. I see.
Is it beneficial to use a water pick if you already floss?
Yeah, I think it could still like, especially in the back or areas where there's like a bigger like gap. But it's
And
not-
then, what's the order of like brushing, flossing, and water pick? What would you recommend?
So I've actually asked a lot of dentists too. So some say like I actually brush my teeth, floss, and then mouthwash.
okay.
Yeah.
Oh, mouthwash.
But some
okay.
people do floss, brush, and then mouthwash. Yeah. But
Is
I
it
think as long
just-
as you do them.
Oh, okay.
Yeah. I just
Mouthwash.
don't want to see so much food come out first.
Yeah.
I think. Yeah. Also leaving the toothpaste in your mouth. Like you're just supposed to spit. You're not supposed to rinse the water because you want the fluoride to like stay in your mouth.
Oh, right.
Yeah.
But it's okay to swallow it. Like if some of
I think a little
probably
bit.
gonna
is
Wait,
fine.
you
swallow
say
it
that
at
one more
some
time?
point.
You have to.
So you know when after you brush, do you gargle water? Like
I
rinse?
spit immediately and then I gargle water.
Okay, but I'm saying like dentists say that you're supposed to just leave. Like you're supposed to spit
Spit the
and
residual and then don't
rinse
gargle
the water.
Oh,
Yeah.
That's
interesting.
crazy.
Because the fluoride in the
That makes
toothpaste
sense.
helps to like
I see.
seep in there.
I see. Wow.
But then how
The
do you
more
do
you know.
mouthwash after?
Well, I think it'll still be in there, and because the mouthwash probably has fluoride too.
Oh, okay.
Yeah, you just rinse it out.
I've also heard that mouthwash is a scam.
Some of them, yeah. Also, there's a lot of products. If it has ADA seal, it's probably more safe because it's been tested.
Oh.
Even like some of like the Crest, like they don't have like some of the Crest do, some of the Colgate do, like some don't.
What are they testing for?
I think like some of the toothpastes have like different research studies on it, so effectiveness and things like that. But I think a lot of my patients, but also friends that have sensitive teeth, the Sensodyne I think is the best.
When like a brand like Colgate comes out with so many reiterations of one toothpaste, is anything actually being changed? Because they're like 24-hour protection and then like all around
Whitening
protection and then white.
yeah.
Does anything actually
Gingivitis
change with the
and
formula? Yeah.
cavity, whatever.
I'm not too sure, honestly, but I think
Okay.
maybe sometimes the ingredients are a little different. Like
Right.
even for Sensodyne, some of the sensitivity ingredients are like potassium nitrate. Some is like sodium, like fluoride or something. So I think looking for the right ingredients, and then like I said, the ADA seal. Yeah, but I was also like, oh, is this a marketing strategy? Yeah, there's so many.
So many.
Yeah, because when you go in the store, you're like, which one do I
Yeah,
get?
There's so many
exactly.
toothpastes.
Yeah. And
So-
people say stay away from whitening toothpaste.
Why?
Or like use them once in a while because they're more abrasive.
Oh.
Yeah.
So when I asked my dentist about whitening stuff, they told me to use Sensodyne at least 2 weeks before I do like a whitening strip or something or a whitening treatment, and then use it for 2 weeks after. And don't get Sensodyne whitening toothpaste because it counteracts. And basically they were saying that Sensodyne has, I'm like going to say this in the worst way possible and not scientifically, but there's like proteins or something that help protect the teeth that Sensodyne will help.
scientific.
Yeah, protein. That Sensodyne helps restore or something. But if you do the whitening toothpaste, then it counteracts. So it doesn't actually help.
Yeah, I'm not sure with the Sensodyne formula, but I think if it's like whitening, I'm sure it would like, yeah. Because I think it's trying to create a barrier so that it's less sensitive. But if you're doing whitening, it has to like seep in more. So maybe that's why.
Okay.
Yeah.
All right, we have one more quick rapid fire stuff, but
go.
before we leave the dentistry stuff, I do want to ask if you have any advice for the general public in terms of like preventative like tips and tricks for teeth. Just like for example, for PTs, we say like strength training can go a long way in your old age. Is there anything like that for like dentistry?
I would
Like-
say like make sure you try to go to your 6-month like exam and
Oops.
cleaning, just to keep up with it. Just so like it's more preventative. Then you don't want to like end up with something that is so much bigger than like they can monitor the decay and observe it at that moment and let you know of it, rather than you go and you're like, oh shoot, you might have to take the tooth out, like to that point. Because I think a lot of people that I've treated at school too, like they just weren't informed, or like they haven't seen a dentist in years, so they think like one thing is a quick fix, but it's not. But if you keep maintaining it, then I think it's more likely that you'll like not go down like a bad route. Yeah.
Okay, I have one last question. I feel like sometimes the narrative that I hear is that some dentists are trying to just like money grab, because like I feel like a lot of patients in general public don't actually understand teeth, and like they just take their dentist's word for it and like maybe don't ask for a second opinion or something. So like for example, in New York City, I'm gonna at Tend right now, because Tend, I've like been a victim of the multiple times. Like they just want to get into my teeth all the time. So how can people trust like what actually needs to be done versus like if like a dentist or an organization just wants to get in your teeth for money?
Yeah, that's a very valid question, because there's a lot of corporate offices like Tend, and a lot of just corporate offices, and a lot of graduates tend to go there because they have really good benefits like insurance and like salary and things like that. But I think they also ethically, some of them, not all of them, make you overproduce kind of. So you're kind of like over treating patients because they want you to produce a certain amount. So I think it's hard. That's why I think leaning into smaller private practices and kind of building a rapport with the dentist, because I know a lot of these corporate offices, you see one dentist, next time you see another dentist, and you're like, the continuation of care feels not like seamless.
Yeah.
Patients wouldn't know if they have that decay or not, but maybe sometimes getting a second opinion, yeah, I guess that would be helpful. But also like not being afraid to like go to a different office if you don't feel like they're treating you well.
Yeah.
They're supposed to send your records to the next place. So But it's very valid, because I think on the like dentist side, where we're trying to look for jobs, like students are kind of lured into corporate because they'll take in the graduates, but the smaller offices it's harder because and like the benefits and they do want mentorship at a smaller private office, but you might not do as much. so you have to really gamble. And I think once you get more skilled, then you kind of have more options. But in the beginning, you kind of look at the money signs because we have so much debt to pay off. Like we come out with like $500,000.
Oh my gosh.
It's like, what do? You also have to pay your loans. So
That's just the healthcare.
Yeah.
I mean, sadly, that's the truth. Like,
I think that's another misconception. Like people think, like we do make money, but we also come out with so much.
yeah, for sure.
Yeah. Would you want your own practice someday?
I do, but I also feel like what's hard is it's a business.
Yeah.
And I think health and like business, it could work really well, but at the same time, I think that's why it could be really hard because like I studied to become a dentist and school didn't teach us how to be like businesswomen, businessmen. Yeah.
Which is interesting. I feel like as healthcare providers, especially in dentistry, I feel like it could be quite common to go that route too. But I guess that makes sense. You could like supplement that in like other grad schools too.
A lot of corporates are buying out like smaller practices. So I feel like our generation is going to start seeing a shift of seeing all these like corporate dental offices. But maybe it'll only last for a little bit and switch it over again.
I feel like the sad part is like as like students, like new grads especially, this is like the reality that we're hit with, and we wish that we can change something. But it's just like this is the healthcare system right now. It's just the way it is right now, and there's nothing we can do about it. It sucks.
Yeah.
And
also, I wanted to ask you too, like for insurance, because like a lot of patients come in thinking it's going to pay for everything, and I'm like, it's kind of a coupon. But I think it's because medical insurance, the way it's paid, it's like they have so much more reimbursement. Whereas like, at least for dental, like it's not that good. Medicaid will pay for certain things, but you have to wait for pre-authorization. And it could take up to like 3 weeks.
Oh my gosh.
Yeah.
So you're just kind of letting them stay like that for a bit.
Yeah, I think the hardest part of like the PT side of thing with the insurance stuff is you'll see a patient who needs the PT, but it just denies them, and there's nothing we can do about it. And especially for our Medicare, Medicaid patient, for PT, you get 30 visits a year, and then past that, you have to basically prove that they're medically necessary. But sometimes what is medically necessary in insurance's eyes is as long as he can walk, he's fine. Like you literally have to be like a chronic stroke patient to stay in PT. But I have a lot of patients who are like 90 years old and they just want to be able to walk again. But then insurance is like, oh, he can stand for 10 seconds. He's like, fine.
Oh my gosh.
Yeah, it's so hard when it's like the treatment is based on what insurance covers.
It's so
so a lot of dentists, I think the ultimate goal is to be fee for service. Like, don't take any insurance.
Yeah.
But then that's also hard because what about the population that they...
Exactly. It just becomes cash based, and it's like...
the realities of healthcare.
Yeah.
Okay, pivoting real quick. You are leaving New York soon to do your residency, so we're going to do a quick New York recap. Favorite cafe in New York to go to?
Yeah,
and your
I was
go-to
thinking
order.
about this actually because I am the type of person to go to like different places. I don't really go back to the same place unless it was really good, just because New York has so many good options. So favorite cafe, I was like right now, like not cafe, but like I thought like Molly tea was really good.
Oh my gosh, it's so
and Hey
good.
tea,
Wait,
Hey
really?
yogurt,
It's that good?
Wait, you
Molly
still
tea?
haven't had it?
No.
You have to have
Okay. See, the issue with New York is that they open just like random shit, and then it gets so much popularity. Like Chicha Sanchez.
Yeah.
It's good. It's good. Like Hey Tea is good, but nothing has been like mind blowing. But it
Maybe
sounds
your
like
standards are really high.
But it sounds like Molly Tea might be.
It's not mind. It's really good. But it's not mind
better than
blowing.
Chicha Sanchez and Hey Tea.
I think their tea quality is really good.
Yeah.
Have you had Hey Tea Labs yet?
Yeah, so the one in Times Square?
Yes.
It was so good. But it's like $12, $13.
Yeah, it's crazy.
Okay, I need to try Molly Tea.
Yeah.
Okay. Favorite brand to shop at the moment?
Right now, okay, I got this thing
It's
from
so
Sandro,
cute.
so I like, and then their sister store like Maj. Yeah, I just like the tweed jacket look right now.
Between
Yeah,
New
really-
Jersey and Manhattan. You've been in both. Which one has been your favorite?
I think Manhattan has so many more things to do, but I think it's also really hard to get like reservations. So I think that's what's annoying. You have to plan so way in advance.
How's the food scene in Jersey?
I think Jersey, I think for like Korean food, especially, it's so much cheaper, and I think it's better than Manhattan. I think
Whoa.
the Korean food actually in Flushing is really good, but
Yeah.
Manhattan, I think Korean food is overpriced.
Yeah.
Yeah, not that good. Hot take.
What about Jersey Korean food versus Flushing Korean food?
I feel like I eat more in Jersey, so I'm kind of biased, but I think Flushing's really good too. But I know more places in Jersey, so if you ever need recs, give me them all. Yeah.
Hit up Joanne.
Damn.
Yeah.
All right, I think that is all we have planned.
Wow, that went fast.
I know, it went
Yeah.
fast. Do you still feel nervous?
No. Yeah, so nice talking to you guys. It made it so chill.
Any last words, Joanne?
Yeah, so if you guys ever need any like resources or tips if you're applying to dental school or have any questions, like feel free to reach out to me, whether it's like residency or even just getting into dental school, or also healthcare. Like I have a lot of friends in the healthcare world, so if anyone needs to be plugged in or connected to someone, I can do that for you. And I love like just connecting people as well. And yeah, whoever's in LA, hang out with me. I'm trying to make new friends, so see you there.
I'm so excited for your LA era. As sad as I am to
I know, I'm
see
so
you
sad.
leave, but that just means I can come visit you too.
Yeah, enjoy the sun.
Yeah.
We'll enjoy the gloom and moist summer.
Oh goodness. But Joanne is such a connector, honestly, and a good mentor. So definitely reach out to her. We'll put her socials in the description.
Yes.
But yeah, that kind of wraps up our episode. Thank you guys so much for tuning in as always. We appreciate you and we love you guys. With that,
TTYL.